Hi. My friend over here was kind enough to just allow us to be able to talk about his situation. He's 63, been living in Florida for quite a while now, dealing with this rotator cuff and biceps pain.
Yes.
And it's just gotten to be time to get it taken care of. The conservative management failed, including a lot of aspirin that you were taking, which I'm worried about.
Yes.
Yeah, so basically it's time to get. We tried conservative management, just didn't work too well, so we're going to proceed soon. Thanks.
Yeah. Thank you.
So this is the inside of the left shoulder of a 62-year-old gentleman who has been dealing with chronic rotator cuff and shoulder pain for years. This is his superior labrum that's torn. This is the socket. It's a little hard to see, but that's the socket that's intact, the ball. This is the long head of the biceps tendon, which we hear about a lot. That's damaged as well, but more importantly, if you look at this rotator cuff tear, very shredded rotator cuff, this tendon tissue is supposed to be attached here. So we're going to do a rotator cuff reconstruction down to here. We're going to reconstruct this biceps tendon, take out a couple of squares. So now we've constructed and put an anchor around the biceps tendon and connected it here. And so now we do what's called a biceps tenodesis. Now that the biceps, instead of being torn and connected there, now it's going to be connected more distally. Distally means on the other side, actually. You want to be careful not to cut the rotator cuff. There's the biceps now. Instead of being over here, the biceps is now over